Hello and a warm welcome to our channel. I'm so glad you've joined us today. We're diving deep into a topic that touches many lives, often in very personal and profound ways. The journey to parenthood and the many factors that can influence it. In this video, we'll be exploring some of the most frequently asked questions surrounding fertility. We'll unravel the complex connections between conditions like thyroid disorders and diabetes and their impact on your ability to conceive. We'll also discuss practical steps you can take to enhance your fertility, explore options for those facing challenges, and demystify advanced reproductive technologies like IVF. Our goal today is to provide you with clear, evidence-based information that can empower you on your unique journey. We'll cover everything from lifestyle adjustments and when to seek medical advice to understanding fertility preservation and the latest advancements that are helping so many build their families. We'll even touch upon specific cases and the science behind them, aiming to answer your questions with clarity and compassion. We understand that navigating the world of fertility can sometimes feel overwhelming, filled with medical jargon and uncertainty. That's why we're here to break it down for you. We believe that knowledge is power, especially when it comes to your health and well-being. So if you're looking for reliable insights into fertility, thyroid health, diabetes management in relation to conception, the intricacies of IVF, and much more, you've come to the right place. I encourage you to settle in, perhaps grab a notepad and join us for this important discussion. And if you find this information valuable, please consider liking this video and subscribing to our channel for more health insights. Your support helps us continue to bring these crucial conversations to a wider audience. Understanding how systemic health conditions like thyroid disorders and diabetes can influence fertility is absolutely crucial for anyone planning a family. Let's start with the thyroid, a small gland in your neck that plays a massive role in regulating your metabolism and, importantly, your reproductive hormones. When the thyroid is underactive, a condition known as hyperthyroidism or overactive hyperthyroidism, it can throw this delicate hormonal symphony out of balance. This imbalance can directly interfere with ovulation in women, making it irregular or even preventing it altogether. Without regular ovulation, the chances of conception naturally decrease significantly. For women, an improperly functioning thyroid can also affect the luteal phase of the menstrual cycle, which is the period after ovulation when the uterine lining prepares for a potential pregnancy. Thyroid issues can shorten this phase or make the lining less receptive to a fertilized egg. Furthermore, untreated thyroid conditions have been linked to an increased risk of miscarriage and potential complications during pregnancy. It's not just about getting pregnant, but also about maintaining a healthy pregnancy. Therefore, ensuring your thyroid is functioning optimally is a key first step in the fertility journey, and often simple medication can correct these imbalances effectively. Now let's turn our attention to diabetes. This condition, characterized by high blood sugar levels, can also cast a long shadow over fertility, affecting both men and women. In women, diabetes, particularly if poorly controlled, can lead to irregular menstrual cycles and an ovulation similar to thyroid disorders. The hormonal disruptions caused by insulin resistance or insufficient insulin production can directly impact the ovary's ability to release eggs. Moreover, women with diabetes may face a higher risk of conditions like polycystic ovary syndrome or PCOS, which is itself a major cause of infertility and is often linked with insulin resistance. For men, diabetes can be equally detrimental to reproductive health. High blood sugar levels can damage blood vessels and nerves, including those essential for normal erectile function. This can make intercourse difficult or impossible. Beyond the mechanical aspects, diabetes can also negatively impact sperm quality. Studies have shown that men with diabetes may have lower sperm count, reduced sperm motility, which is the ability of sperm to swim effectively, and increased DNA fragmentation within the sperm. Damaged sperm DNA can make fertilization less likely or lead to early pregnancy loss if fertilization does occur. Managing blood sugar levels effectively is paramount for men hoping to father children. The common thread here is hormonal balance. Both the thyroid gland and the systems regulating blood sugar are integral parts of the body's endocrine system. When one part of this system is out of sync, it can create a cascade effect, impacting other hormonal pathways, including those governing reproduction. For example, high insulin levels seen in insulin resistance can stimulate the ovaries to produce more androgens, or male hormones, which can disrupt ovulation. Similarly, thyroid hormones interact with estrogen and progesterone, the primary female reproductive hormones, and their imbalance can disrupt the entire menstrual cycle. It's also important to recognize that these conditions can coexist. For instance, autoimmune thyroid disease is more common in individuals with type 1 diabetes. When both conditions are present, the impact on fertility can be compounded. Therefore, a comprehensive medical evaluation that assesses both thyroid function and glucose metabolism is often a critical component of a fertility workup. Especially if a couple is experiencing difficulties conceiving, addressing these underlying health issues can sometimes be the key to unlocking fertility potential. The good news is that with proper diagnosis and management, the negative effects of thyroid disorders and diabetes on fertility can often be mitigated. For thyroid conditions, medication can restore normal hormone levels. For diabetes, lifestyle modifications, oral medications, or insulin therapy can help achieve optimal blood sugar control. Preconception counseling is highly recommended for individuals with these conditions, allowing healthcare providers to optimize their health before they even start trying to conceive, significantly improving the chances of a successful pregnancy and a healthy baby. So the key takeaway is that your overall health is intrinsically linked to your reproductive health. Conditions that might seem unrelated to fertility, like an underactive thyroid or elevated blood sugar, can in fact be significant roadblocks. Recognizing these connections, seeking appropriate medical care, and actively managing these conditions are proactive steps that can make a world of difference on the path to parenthood. Early detection and intervention are truly vital. When you're trying to conceive, it's natural to want to do everything in your power to increase your chances. The great news is that there are several evidence-based lifestyle adjustments you can make that can positively impact your fertility. Our first tip is to focus on maintaining a healthy weight. Being significantly underweight or overweight can disrupt hormonal balance and interfere with ovulation in women and affect sperm quality in men. Adopting a balanced diet rich in fruits, vegetables, lean proteins, and whole grains, combined with regular moderate exercise, can help you achieve and maintain a body mass index within the healthy range. Our second tip centers on managing stress. While the direct link between stress and infertility can be complex, chronic stress can certainly lead to hormonal imbalances that affect reproduction. It can disrupt the hypothalamic pituitary adrenal axis, which in turn can influence the hypothalamic pituitary gonadal axis, the system that controls reproductive hormones. Finding healthy ways to cope with stress, such as practicing mindfulness, meditation, yoga, spending time in nature, or engaging in hobbies you enjoy, can be incredibly beneficial, not just for your overall well-being, but potentially for your fertility too. The third crucial tip is to understand and track ovulation. For conception to occur, sperm needs to meet an egg, and this can only happen during a relatively short window each month, typically the day of ovulation and a few days leading up to it. Women can track their cycles using various methods, from simple calendar tracking and monitoring basal body temperature to using ovulation predictor kits that detect the surge in luteinizing hormone that precedes ovulation. Knowing your fertile window allows you to time intercourse appropriately, significantly increasing the likelihood of conception. Our fourth tip involves avoiding substances known to harm fertility. This is a big one. Smoking, for instance, has been definitively linked to reduced fertility in both men and women. It can damage eggs and sperm, accelerate ovarian aging, and increase the risk of miscarriage. Similarly, excessive alcohol consumption can negatively impact hormone levels, ovulation, and sperm production. Illicit drug use can also have severe consequences for reproductive health. Minimizing, or ideally eliminating these substances, is a powerful step towards optimizing your fertility. Finally, our fifth tip is to seek medical advice early if you have concerns. While it's normal for conception to take some time, general guidelines suggest consulting a healthcare professional or a fertility specialist if you're under 35 and have been trying to conceive for a year without success, or if you're 35 or older and have been trying for 6 months. If you have known medical conditions that might affect fertility, such as irregular periods, PCOS, endometriosis, or a history of sexually transmitted infections, it's wise to seek advice even sooner. Early intervention can identify potential issues and lead to timely treatment or guidance. Beyond these 5 core tips, it's also worth mentioning the importance of a preconception checkup. This allows your doctor to review your medical history, medications, lifestyle, and ensure you're up to date on vaccinations. They might also recommend starting prenatal vitamins, particularly folic acid, even before you conceive, to support a healthy pregnancy from the very beginning. This proactive approach sets a strong foundation for your fertility journey. Consider also the impact of environmental toxins. While harder to control, being mindful of exposure to certain chemicals, pesticides, and plastics may also play a role. Opting for organic foods when possible, using glass containers instead of plastic for food storage, and choosing natural cleaning and personal care products are small changes that could contribute to a healthier reproductive environment. Every little bit helps when you're aiming to create the best possible conditions for conception. Remember, these tips are about empowering you to take control of the factors you can influence. While not every fertility issue can be resolved through lifestyle changes alone, these foundational steps can significantly improve your natural fertility, prepare your body for pregnancy, and work in concert with any medical assistance you may eventually need. It's about creating an optimal internal environment for a new life to begin. Discovering that conceiving a baby naturally isn't happening as quickly or easily as you hoped can be an emotionally challenging experience. It's a journey filled with ups and downs, and it's important to know that you're not alone and there are many avenues of support and medical options available. The very first and most crucial piece of advice for couples facing these difficulties is to consult a fertility specialist. These medical professionals are experts in reproductive endocrinology and infertility, and can conduct a thorough evaluation of both partners to identify any underlying causes. This evaluation typically involves a detailed medical history, physical exams, blood tests to check hormone levels, and semen analysis for the male partner. For the female partner, tests might include an assessment of ovarian reserve, checks for ovulation, and an evaluation of the fallopian tubes and uterus, often using imaging techniques like ultrasound or a hysterosalpingogram. Getting a clear diagnosis or even identifying contributing factors is the cornerstone of developing an effective treatment plan. Don't delay this step out of fear or uncertainty. Knowledge is power. Alongside seeking medical expertise, it's also a good time to reevaluate and explore lifestyle changes that can support fertility, many of which we've already discussed. This includes optimizing nutrition, achieving a healthy weight, managing stress, quitting smoking, and reducing alcohol intake. While these changes may not solve all fertility problems, they can improve overall health and potentially enhance the success rates of medical treatments. Think of it as preparing your bodies to be in the best possible condition for conception, whether it happens naturally or with assistance. If lifestyle modifications and addressing any underlying health issues don't lead to pregnancy, your fertility specialist will discuss various medical options. These can range from relatively simple interventions to more advanced reproductive technologies. For some couples, medications to induce ovulation, such as clomiphene citrate or letrozole, might be the first step, especially if irregular ovulation is identified as the primary issue. These medications can help stimulate the ovaries to produce and release eggs more regularly. Another common option, often used in conjunction with ovulation induction, is intrauterine insemination, or UI. This procedure involves placing specially prepared sperm directly into the uterus around the time of ovulation. IUI can be beneficial in cases of mild male factor infertility, cervical mucus problems, or unexplained infertility. It's a less invasive and less expensive option than IVF, and for many couples it can be an effective stepping stone. Your specialist will help you determine if IUI is a suitable choice based on your specific circumstances. For couples facing more significant fertility challenges such as blocked fallopian tubes, severe male factor infertility, diminished ovarian reserve, or when other treatments have been unsuccessful, in vitro fertilization or IVF may be recommended. IVF is a more complex process involving ovarian stimulation to produce multiple eggs, egg retrieval from the ovaries, fertilization of the eggs with sperm in a laboratory setting, and then the transfer of one or more resulting embryos into the uterus. While IVF is a significant undertaking, it offers the highest success rates per cycle for many infertility diagnoses. Throughout this journey, it's incredibly important to prioritize emotional well-being and mutual support as a couple. The process of trying to conceive, especially when faced with challenges, can be stressful and emotionally draining. Seeking support from counselors, support groups, or even trusted friends and family can make a significant difference. Open communication between partners is also vital. Remember, you are a team. Navigating this path together and supporting each other's emotional needs is just as important as the medical treatments. Finally, be patient with yourselves and the process. Fertility journeys are rarely linear, and there can be setbacks along the way. It's important to maintain hope, stay informed, and work closely with your healthcare team. Advances in reproductive medicine are constantly evolving, offering new possibilities and improved outcomes. Your specialist will guide you through the options, helping you make informed decisions that are right for your family-building goals. Fertility preservation, which involves freezing eggs, sperm, or embryos for future use, is a rapidly advancing field in reproductive medicine that offers hope and options to many individuals. Deciding whether this path is right for you involves considering a variety of factors, including age, medical conditions, upcoming medical treatments that might impair fertility, and, of course, personal life circumstances. It's a proactive step that can provide peace of mind and expand future family-building possibilities. One of the most common reasons women consider egg freezing, also known as oocyte cryopreservation, is age. Female fertility naturally declines with age, particularly after 35, as both the quantity and quality of eggs decrease. For women who are not ready to start a family but wish to preserve their option to have biological children later in life, egg freezing can be a valuable choice. Freezing eggs at a younger age essentially stops the clock on those eggs, preserving their quality at the age they were retrieved. Medical conditions and their treatments are another significant driver for fertility preservation. For instance, individuals diagnosed with cancer who require chemotherapy or radiation therapy often face a high risk of damage to their reproductive organs and gametes. Fertility preservation before starting such treatments can be a crucial step. For men, sperm banking before cancer treatment is a well-established procedure. For women, egg or embryo freezing offers similar protection for their future fertility. Other medical conditions like autoimmune diseases requiring certain medications or surgeries that might affect reproductive organs also warrant a discussion about fertility preservation. Upcoming medical treatments, even those not directly related to cancer, can sometimes impact fertility, and certain surgeries, for example, those involving the ovaries or testes or medications for chronic conditions, might have unintended consequences for reproductive potential. If you are facing any medical intervention that carries a risk to your fertility, it's essential to have a conversation with your doctor and a fertility specialist about preservation options before you begin treatment. Time is often of the essence in these situations. Personal circumstances also play a role. Some individuals may choose fertility preservation due to career goals, lack of a partner, or simply a desire to delay parenthood for personal reasons. This is often referred to as elective or social egg freezing. It's a way for individuals to take some control over their reproductive timeline, alleviating the pressure that can come with the biological clock. The decision is deeply personal and should be made after careful consideration and consultation with a fertility expert. For couples undergoing IVF, embryo freezing is a common practice. Often, an IVF cycle results in more viable embryos than are transferred in a fresh cycle. These surplus embryos can be cryopreserved for future use, perhaps for a sibling, or if the initial transfer is unsuccessful. This avoids the need to undergo the entire ovarian stimulation and egg retrieval process again, making subsequent attempts less invasive and less expensive. Embryo freezing has excellent success rates, with frozen embryo transfers now being a mainstay of IVF treatment. The process for egg freezing involves ovarian stimulation with hormones to produce multiple eggs, followed by an egg retrieval procedure, which is similar to the initial stages of IVF. The mature eggs are then vitrified, flash frozen, and stored. For sperm freezing, the process is typically simpler, involving the collection of a semen sample, which is then analyzed, processed, and frozen. Embryo freezing occurs after eggs have been retrieved and fertilized with sperm in the lab, with the resulting embryos being frozen at a specific developmental stage. Ultimately, the decision to freeze eggs, sperm, or embryos is a deeply personal one, best made in consultation with a fertility specialist who can assess your individual situation, discuss the risks and benefits, success rates, and costs involved. It's about understanding your options and making an informed choice that aligns with your life goals and circumstances. Fertility preservation is a powerful tool that empowers individuals to plan for their future families on their own terms. The recent news about Sidhu Moosewala's parents welcoming a baby boy has brought a lot of attention to the possibilities of assisted reproductive technology, particularly for parents of advanced maternal and paternal age. While specific personal medical details are private, reports have indicated that Sidhu Moosewala's mother, Charan Kaur, conceived through in vitro fertilization, or IVF. This case highlights the remarkable advancements in reproductive medicine that allow individuals to pursue parenthood even later in life. IVF, as we've touched upon, is a process where eggs are retrieved from the mother's ovaries and fertilized by sperm from the father or a donor in a laboratory. The resulting embryos are then cultured for a few days before one or more are transferred into the mother's uterus with the hope of implantation and pregnancy. In cases involving advanced maternal age, the quality and quantity of a woman's own eggs can be a significant challenge. While not officially confirmed in this specific case, it's common in such situations to consider the use of donor eggs if the mother's ovarian reserve is very low or egg quality is a concern. Using donor eggs means that eggs are retrieved from a younger, healthy donor, fertilized with the father's sperm or donor sperm, and the resulting embryo is then transferred to the intended mother's uterus. The intended mother then carries the pregnancy and gives birth to the child. This allows women who may no longer have viable eggs of their own, due to age, premature ovarian failure, or other medical reasons, to experience pregnancy and childbirth. The child would be biologically related to the father if his sperm is used, and the egg donor, but the intended mother is the gestational carrier and the birth mother. The success of IVF, especially in women of advanced maternal age, often relies heavily on the quality of the eggs and embryos. If a woman is using her own eggs and she is older, the chances of chromosomal abnormalities in the eggs increase, which can lead to the lower implantation rates or higher risks of miscarriage. Pre-implantation genetic testing, or PGT, can sometimes be used in these scenarios to screen embryos for chromosomal normalcy before transfer, potentially improving the chances of a successful pregnancy. It's important to acknowledge that pregnancy at an advanced maternal age, typically considered 35 and older, and certainly in the 50s, comes with increased medical risks for both the mother and the baby. These can include a higher likelihood of gestational diabetes, preeclampsia, preterm birth, and other complications. Therefore, women pursuing pregnancy at an advanced age require careful medical evaluation and high-level obstetric monitoring throughout their pregnancy and delivery. The health and well-being of the mother are paramount. The case of Sidhu Moosewala's mother serves as a powerful example of how far reproductive technology has come. It offers hope and possibility where, just a few decades ago, there might have been none. It underscores that the desire to have a child can be strong at any age, and modern medicine is increasingly able to support those dreams, provided the health and ethical considerations are carefully managed. Each journey is unique, and the decisions involved are deeply personal. This story also opens up conversations about family building in various circumstances and highlights the role of science in overcoming biological limitations. It reminds us that families are formed in many ways, and assisted reproductive technologies like IVF are legitimate and often life-changing paths to parenthood for millions around the world. The focus should always be on the health of the mother and child, and the informed choices made by the parents. Ultimately, while we celebrate the joy of a new life, it's also an opportunity to understand the science and the careful medical considerations that often underpin such remarkable stories. It speaks to the dedication of reproductive specialists and the resilience of individuals and couples who embark on these often complex but ultimately rewarding journeys to build their families. A common question and understandable concern for many parents considering or undergoing IVF is whether a child born from a frozen embryo is any different, particularly in terms of health and development, compared to a child conceived naturally or from a fresh embryo transfer. The overwhelming scientific evidence and years of clinical experience provide a reassuring answer. Children born from frozen embryos are, by and large, just as healthy as those born from fresh embryos or natural conception. The process of freezing and thawing embryos, known as cryopreservation, typically vitrification, a flash freezing method, has been refined over decades. Modern techniques are highly effective at preserving the viability of embryos. Only robust, good quality embryos are typically selected for freezing, and the process itself is designed to minimize any potential damage. Extensive research has followed children born from frozen embryos for many years, looking at various health outcomes. Studies comparing children born from frozen embryo transfers to those from fresh embryo transfers and natural conceptions have generally found no significant differences in terms of birth defects, chromosomal abnormalities, or long-term developmental milestones. In fact, some studies have even suggested potential benefits associated with frozen embryo transfer in certain aspects, such as slightly higher birth weights and a lower risk of preterm birth compared to fresh IVF transfers, possibly because the uterine environment at the time of a frozen transfer can be more physiologically normal, as it's not immediately following ovarian stimulation. It's important to understand that the genetic makeup of the child is determined at the moment of fertilization, long before an embryo is frozen. The freezing and thawing process does not alter the embryo's DNA or genetic code. The health of the child is primarily influenced by the genetic material from the egg and sperm, the uterine environment during pregnancy, and postnatal factors, just as it is with any conception. Concerns about the age of the embryo often arise, for example, if an embryo was frozen for 5 or 10 years. However, once an embryo is properly cryopreserved in liquid nitrogen at extremely low temperatures, around -196 degrees Celsius or -321 degrees Fahrenheit, all metabolic activity essentially ceases. The embryo is in a state of suspended animation. Therefore, the duration of storage does not appear to impact the health or developmental potential of the resulting child. Successful pregnancies have been reported from embryos frozen for over 2 decades. Of course, as with any pregnancy, there are always background risks of certain health issues or developmental variations, regardless of how conception occurs. The key point from research is that the use of frozen embryos in itself does not add a significant layer of risk for the child's overall health and development compared to other methods of conception. Fertility clinics adhere to strict protocols for embryo handling, freezing, and thawing to ensure the best possible outcomes. Parents can feel confident that choosing to use frozen embryos, whether they are surplus from a previous IVF cycle or from an embryo created specifically for a frozen transfer, is a safe and effective way to build their family. The focus remains on creating the healthiest possible embryos through good laboratory practices and ensuring a healthy uterine environment for implantation and growth. The millions of healthy children born worldwide using this technology are a testament to its safety and efficacy. So, to put it simply, the method of an embryo's storage before implantation, whether it was transferred fresh or after being frozen and thawed, does not fundamentally change the resulting child. They are loved, cherished, and are just as likely to grow up healthy and strong. The miracle of life, facilitated by these advanced technologies, is something to be celebrated without undue worry about the process itself harming the child's long-term well-being. In vitro fertilization, or IVF, is a cornerstone of modern assisted reproductive technology, offering hope to many facing infertility. Let's break down how this intricate process typically works. It usually begins with ovarian stimulation. The woman takes injectable hormone medications for about 8 to 14 days to encourage her ovaries to produce multiple mature eggs, rather than the single egg that typically develops in a natural cycle. Regular monitoring through blood tests and ultrasounds tracks the growth of the ovarian follicles containing the eggs. Once the eggs are deemed mature, the next step is egg retrieval. This is a minor surgical procedure, usually performed under sedation or light anesthesia. A fertility doctor uses an ultrasound-guided needle inserted through the vaginal wall to aspirate the fluid and the eggs from each mature follicle in the ovaries. This procedure is relatively quick, often taking about 20 to 30 minutes. The retrieved eggs are then immediately taken to the embryology laboratory. In the lab, the eggs are prepared and then fertilized with sperm. The sperm can be from the male partner or a donor. Fertilization can occur through conventional insemination, where eggs and sperm are mixed in a dish, or via intracytoplasmic sperm injection, or ICSI, where a single healthy sperm is injected directly into each mature egg. ICSI is often used in cases of male factor infertility or if previous IVF attempts with conventional insemination were unsuccessful. The embryologists then monitor the eggs for signs of fertilization. The fertilized eggs, now called embryos, are cultured in the laboratory for several days, typically 3 to 5, or sometimes even 6 or 7 days, allowing them to develop. During this time, embryologists assess their quality and development. This leads us to pre-implantation genetic testing, or PGT. PGT is an optional test that can be performed on embryos before they are transferred to the uterus. It involves taking a small biopsy of cells from each developing embryo. These cells are then analyzed for specific genetic or chromosomal information. There are different types of PGT. PGT-A, or aneuploidy screening, checks embryos for the correct number of chromosomes. Aneuploidy, or having an abnormal number of chromosomes, is a major cause of implantation failure, miscarriage, and conditions like Down syndrome. PGT-M, for monogenic or single-gene defects, is used when there's a known risk of passing on a specific inherited genetic disorder like cystic fibrosis or Tay-Sachs disease. PGT-SR, or structural rearrangements, is for individuals who are carriers of chromosomal translocations or inversions. The goal of PGT is to select the chromosomally normal or unaffected embryos for transfer, potentially increasing the chances of a successful pregnancy and reducing the risk of certain genetic conditions. The cost of PGT testing can vary significantly depending on the clinic, the type of PGT being performed, and the number of embryos being tested. On average, PGT-A might add anywhere from $3,000 to $7,000 or more to the overall cost of an IVF cycle in many regions. This is in addition to the base cost of the IVF cycle itself, which can range from $12,000 to $25,000 or higher depending on medications, procedures, and location. It's crucial to discuss all potential costs with your fertility clinic up front. After the embryos have developed for several days, and if PGT has been done and results are available, the final step of the IVF process is the embryo transfer. One or more selected embryos are loaded into a thin catheter, which is gently passed through the cervix into the uterus, where the embryo is deposited. This procedure is usually quick and painless, similar to a pap smear. Any remaining good quality embryos can be cryopreserved or frozen for future use. About 9 to 14 days after the embryo transfer, a pregnancy test is done to determine if implantation was successful. IVF is a complex, multi-step process that requires significant commitment both emotionally and financially. However, for many, it represents the best chance of achieving pregnancy. Understanding each stage, including options like PGT and their associated costs, allows individuals and couples to make informed decisions in consultation with their fertility care team, navigating this journey with greater clarity and confidence. We've covered a significant amount of information today, from the intricate links between systemic health and fertility to the advanced options available through modern reproductive medicine. It's my sincere hope that this discussion has provided you with valuable insights and a clearer understanding of these important topics. However, please remember that the information shared in this video is for general knowledge and educational purposes only. It is not a substitute for professional medical advice, diagnosis, or treatment. Your individual health circumstances are unique, and it's crucial to consult with a qualified healthcare professional or a fertility specialist for personalized advice tailored to your specific needs and medical history. Thank you so much for investing your time with us today and for being part of our community. We understand that these topics can bring up many questions, and we encourage you to share them. If you have any questions arising from today's video, or if there are other health and fertility topics you'd like us to explore in the future, please don't hesitate to leave them in the comments section below. We do our best to read through your feedback and address your queries in upcoming content. Your engagement helps us create videos that are truly relevant and helpful to you. If you found this video informative and empowering, please show your support by giving it a thumbs up. And to ensure you don't miss out on our future discussions on health, wellness and fertility, make sure to subscribe to the channel and click the notification bell. We are committed to bringing you evidence-based information to help you navigate your health journey with confidence. Until next time, take good care of yourselves and remember that knowledge and proactive care are your greatest allies.